For patients, POTS is feeling tired, not having much energy, not being able to live a normal life. For physicians, it's POTS, P-O-T-S, Postural Orthostatic Tachycardia syndrome. Tachycardia means fast heart. One of the signs of this condition is when somebody changes their posture, their position, from lying down to standing up, the heart beats excessively fast. That's the postural orthostatic tachycardia. The S of POTS is the syndrome. It's the collection of symptoms, including dizziness, headache, fatigue, tummy upset, that gets people down. So POTS is a condition that makes people feel tired, makes them feel run down, often dizzy and very uncomfortable with headaches or tummy aches. Anybody can be affected, but there seem to be two kinds. There's the adult kind of POTS, which affects mostly women between age 30 and age 50. And then what I see as a pediatrician, it affects teenagers. Teenagers usually within about a year of their growth spurt and the beginning of their puberty changes. Usually they're high-achieving teenagers. Majority are girls, but it can be girls or boys. And they're what parents would think are the ideal children. High-achieving, hard-working, thriving in life. And then they get sick. A normal kind of sickness, like mono or something. But instead of bouncing back from it, then it tips their involuntary nervous system out of balance, and they're left tired and run down. Their blood flow is disturbed, so they can't get the blood going to the right place at the right time. So they stand up and feel dizzy. They can't move their food through their intestines well, and they feel run down and uncomfortable. POTS isn't very well known. It was first described and recognized about 15 years ago, first recognized just about 10 years ago in teenagers. So it's newly recognized, not known by everybody, and a lot of patients with POTS look normal. They're high-achieving, happy, nice people that just have trouble getting out of bed and doing much. And some people looking at the surface would just blame it on depression or something that's all in their head. So often the patients, when we see them, have gotten the impression from other healthcare providers that there's nothing wrong and it's all in their head. They feel especially relieved when we can explain what's really going on with their involuntary nervous system, and we can point them toward recovery.
You found?
It was interesting because we know there are ways to treat POTS, but we know that because of what people have said and what we have tried. There have been some studies in adults to see what works, but there have not been very many studies in teenagers to say what really works to help them get better from POTS. So we decided to ask the patients what was working. We knew how we were treating them. We were basing it on the best science available, but we realized we didn't know very well. So we surveyed our patients a year or so after we had seen them and asked how they were doing. And we were fascinated to find that people treated with one particular medicine were doing a lot better than people that were not treated with that medicine. And so it pointed us toward a better understanding of what medicines can really help. So one of the medicines that's been used for POTS in adults and often in teenagers are beta blockers. Beta blockers that most of us think of are for older people with heart disease or high blood pressure. But one of the things that beta blockers do is to tighten up the blood vessels so they don't go so floppy, so that even when people stand up and they have to pump their blood against gravity, the tightened up blood vessels would be able to keep the blood circulating and do better. And we found that using beta blockers is very effective. There are two sorts of medicines we can use to help stimulate the circulation, either the beta blockers or a different alpha medicine called mitidrin. What we found that is both are fairly effective, but almost everybody gets a lot better on beta blockers, and more than half, but not everybody, gets better on mitidrin. So from learning from our patients and surveying them to see how they were a year or so after we had initially seen them, we learned that we needed to put a better emphasis on beta blockers in treatment. When we saw these results a while back and we were analyzing the data, we realized, wow, maybe we need to push beta blockers more. So I used to mix and try to choose. Some patients got the beta blocker, some got mitidrin. I've shifted based on what we learned from this study, so I use beta blockers almost always as my first line of medical treatment for POTS.
To know about POTS.
POTS is real. It relates to the involuntary nervous system, and it points out that we don't know everything in medical science. We're learning a lot about POTS. We know things, but not all physicians are even aware. So I think people need to know that POTS is real, it exists, and it explains lots of chronic fatigue in teenagers. Secondly, it's treatable. Most patients with POTS as teenagers do get better. They should be able to look forward to a complete and good recovery. And if we help them along the way with various kinds of treatment, then we can expect we'll facilitate the recovery and help them function better while they're recovering. And thirdly, as we get to the medical treatment, there are certain medicines that do seem to work better. But people should also know that it's not just about medicine. It takes some changes in diet. People need to eat more salt. They need to drink a lot more fluid, usually with POTS. And they need to get exercising. Their bodies are telling them that they're too tired and they can't exercise. We need to overcome that feeling, that physical feeling, and get them exercising so they can get reconditioned and rehabilitated. Using those non-medicine ways in conjunction with good medicine, people do better.